हेलो गुड मॉर्निंग। मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के न्यूरोलॉजी सेक्शन के सम इम्पॉर्टेंट एमसीक्यू। इन चिल्ड्रेन बर्किट लिम्फोमा कॉमनली प्रेजेंट विद विच ऑफ द फॉलोइंग क्लिनिकल फीचर्स: mediastinal mass, abdominal pain, jaw swelling, lymphadenopathy. Here the best answer is the jaw swelling, because in children if the Burkitt lymphoma commonly present the jaw swelling. Burkitt lymphoma is a highly aggressive type of non-Hodgkin lymphoma, predominantly seen in children and young adults. It often involves the jaw bones and present as a rapidly growing mass causing swellings at the jaw region. And the clinical presentation is also known as the African or endemic Burkitt lymphoma, which is commonly found in the equatorial Africa. Next question. In viral meningitis, what is the typical appearance of cerebrospinal fluid obtained through lumbar puncture? Clear and colorless CSF, bloody CSF, turboid or cloudy CSF, elevated protein level in CSF. Here the best answer is the bloody CSF, because the statement here given the lumbar puncture with viral meningitis shows bloody CSF is the incorrect. It actually question asked the incorrect one. So the statement that lumbar puncture in viral meningitis shows bloody CSF is incorrect, because the viral meningitis is characterized by inflammation of the meningitis caused by the viral infection. Unlikely the bacterial meningitis, viral meningitis does not usually cause for the significant bleeding into the CSF. Therefore, the CSF obtained through lumbar puncture in viral meningitis is typically clear and colorless, or may have a slightly yellowish appearance due to the increased protein content. Due to the increased protein content. Next question. Which of the following diagnostic method is considered gold standard for confirming the diagnosis of chronic lymphocytic leukemia and provides valuable information about the immunophenotype of the leukemic cell? The best answer is the flow cytometry. Flow cytometry, because the considered as the gold standard diagnosis of CLL. It allows to what identification of and characterization of leukemic cells based on what the immunophenotype. And if we analyze the expression of a specific surface marker, flow cytometry can differentiate CLL cells, normal lymphocyte, and other lymphoproliferative disorder, providing important information for diagnosis and the classification. Next question. Which of the following is the most specific laboratory test for the diagnosis of Graves syndrome, a subtype of scleroderma? NTSCL70, antitopoisomerase first antibody, anti-centromere antibody. This one is the best answer, because the most specific laboratory test for the diagnosis of Graves syndrome, a subtype of scleroderma. The presence in the anti-centromere antibody is Graves syndrome is a limited form of systematic sclerosis characterized by calcinosis, Raynaud phenomenon, esophageal dysmotility, and sclerodactyly telangiectasia. Anti-centromere antibodies are detected in approximately 60 to 80% of the patient in Graves syndrome. And the next question is which of the following is key clinical feature commonly observed in patient with acute lymphocytic leukemia? Splenomegaly, lymphadenopathy, sternal tenderness, hepatomegaly. Here the best answer is the sternal tenderness, because the sternal tenderness is a clinical key feature that is observed in the patient with acute lymphoblastic leukemia. It is caused by the infiltration by leukemia into the bone marrow. Infiltration of the leukemia into the bone marrow. including the sternum. And the involvement of the sternum can lead to localized pain and tenderness. Upon palpitation, sternal tenderness can be an important clinical clue that is raises suspicion of ALL, especially when combined with other presenting symptoms. Next question. Uh, what is the median age of diagnosis of acute myeloblastic leukemia in children with Down syndrome? 67 years is the best answer, because children with Down syndrome have a significant increase in. See here, the ask is the question 67 years. Why? Because the children with Down syndrome had a significantly increased the risk of developing of AML compared to the general population. However, the median age at diagnosis of AML in children with Down syndrome is much higher than the typical pediatric AML causes. Studies have shown that the median age of diagnosis of AML in children with Down syndrome around the 67 years. Note is the 67 years, reflecting the fact that AMR is the population tends to occur later in life, not now, later in life. Is the AMR in population that occurs in the later in life. That's why the is answer the 67 and is described as children, because the base year the later in life is shows the later in life by the 67 years. Okay, that's all, and keep revising. Thank you.